Next, we're going to shift gears a little bit and discuss medication therapy management, or MTM. Medication therapy management is a growing service being offered by pharmacists. As the name suggests, MTM utilizes pharmacists to help improve patients' adherence to their medications and reduce any adverse outcomes or reactions associated with their medications. Pharmacists are able to get reimbursed by Medicare if MTM sessions are performed with eligible patients. Here we see some of the MTM eligibility criteria for Medicare patients. Some of the highlights are that they must receive medications from more than one provider, are taking at least 4 medications for chronic conditions, must have at least one chronic condition, such as diabetes, heart failure, or others, and also they must spend at least $4,000 annually on prescription drugs with a Part D benefit. Members must only meet one of these criteria to be eligible for MTM services. So why should you care about MTM services if they will be done by a pharmacist? Since MTM is becoming more common, they are beginning to be performed in new settings, such as community pharmacies. As a pharmacy tech, you will likely be involved in identifying eligible patients, scheduling patient appointments for MTM with pharmacists, or simply hear discussions about MTM in staff meetings.
Medication-related problems are a significant public health issue. Each year, approximately 1.5 million preventable adverse drug events occur. These events cost the health system nearly $177 billion a year in injury and death.
I had just started a new medication for my thyroid. I went back to the doctor 3 times in 1 month because the medication wasn't working. My prescription was changed at each visit, resulting in another office copay and another prescription copay. At my MTM visit, the pharmacist discovered I was taking the medication at the same time as another drug, and it was rendering it ineffective. All I needed to do was change the time of day I took the medication. Not only did I finally start feeling better, but I saved almost $200 in the next month by not having to return to the doctor so frequently. I wish I'd talked to an MTM pharmacist sooner.
MTM services help prevent medication errors and help patients take an active role in managing their health. In a report to the U.S. Surgeon General in 2012, 96% of physicians surveyed reported improved health outcomes when a pharmacist provided collaborative care to their patients. 88% of physicians believe that working with pharmacies has improved their patient care. Research has decisively shown that MTM leads to improved quality of care and reduced costs for patients, especially those patients with chronic disease like diabetes, high blood pressure, high cholesterol, or heart failure.
I had just been diagnosed with diabetes and I started taking a new medication and insulin. The prescription cost me about $60 a month. At my MTM visit, the pharmacist suggested I try a more cost-effective alternative medication, which had also been proven to treat diabetes. He called my doctor to discuss it and they made the change. My diabetes has been under control and I started saving $50 a month on the alternative medication.
MTM visits can decrease the need for future doctor visits, for specialist visits, as well as decrease the number of medications or the cost of medications by finding lower cost alternatives.